On January 12, 2010, at exactly 4:53 p.m., a 7.0 magnitude earthquake struck Haiti. According to the United States Geological Survey, the epicenter was just 25 kilometers from the capital of Port-au-Prince. In less than a minute, entire neighborhoods collapsed. Government buildings were destroyed. Hospitals, schools, homes, all gone. Britannica estimated over 200,000 people lost their lives. More than 1.5 million people were displaced. This wasn't just a disaster, it was a complete breakdown of a nation's infrastructure. And within hours, the world responded. Search and rescue teams were arrived, military units deployed, NGOs, volunteers, medical teams all rushed in. The Red Cross and the Red Crescent movement became one of the largest responders. According to the American Red Cross official reports, they raised over $500 million globally for the Haiti relief. Their mission was massive. They aimed to provide emergency shelter, clean drinking water, medical care, sanitation systems, long-term recovery support. And in the early days, they did save lives. But very quickly, something unexpected started happening. Help was everywhere, but it wasn't always reaching the right place. The airport in Port-au-Prince became overwhelmed. As reported by multiple UN coordination updates, planes carrying aid were circling, unable to land. Supplies were arriving, but distribution systems were not ready. Food sat in storage while people waited outside. This wasn't a shortage of resource, it was a failure of coordination. According to UN OCHA, hundreds of organizations were operating in Haiti at the same time, each with their own system, their own data, their own priorities, and almost no shared platforms. Let's break this down simply. There was no centralized database of needs, no real-time visibility of who was doing what, no unified tracking of funds or projects, limited communications between teams. Everyone was working, but not always working together. Years later, questions began to surface. A 2015 investigation by NPR reported, despite raising nearly $500 million, only a small number of permanent homes has been built. ProPublica also highlighted concerns about transparency and project tracking. Now this is important. This was not about lack of effort. Thousands of people worked tirelessly. Lives were saved. Communities were supported. But the systems were not built for the scale. And this is where the real lesson lies. In humanitarian's work, impact is not just about how much you do, it's about how well everything connects. The Haiti earthquake became a global turning point. Organizations began rethinking how they operate. The UN strengthened the clustered system, assigning clear roles to the organizations. Better coordinations framework were introduced. More investment in digital tracking systems. Improved transparency for donors. Because of one thing became clear. Without coordination, even the biggest effort can fall short. Today, disasters are more frequent than ever. And NGOs are managing more donors, more programs, more data, more pressure. But many still face the same core issue, fragmentation. Haiti didn't just expose a disaster, it exposed a gap between the intention and execution. And closing that gap is where the real transformation begins. And that's exactly why solutions like ZenDonor are being built today. Not to replace the people doing the work, but to support them. To bring clarity, structure, and visibility when everything else feels uncertain. If you are a part of organization handling donors, programs, or impact work, you can explore ZenDonor at ZenDonor.com. But beyond tools, beyond systems, Haiti leaves us something deeper to think about. When help arrives, it has to reach the right hands at the right time, in the right way. Because in moments like that, it's not just about how much the world gives, it's about how well we connect it. This is Beyond the Cause, where we don't just look at impact, we understand what it takes to make it work.